Welcome back. It is 6:20 this morning on this Friday, and joining us this morning in studio, Assemblyman Vince Fong, here to tell us a little bit more about what this new order sent down by the governor last night, declaring this statewide stay-at-home order means. Good morning, Vince. Thanks so much for joining us.
Thank you for having me.
So explain to us a little bit more, what do you want people to know, most importantly, about this new order?
Well, what the order was last night was essentially what we're already asking the community to do, to exercise common sense, to stay at home unless you need to leave for any essential functions to maintain your household. So you can go to the bank, you can go to the dry cleaners, you can go to the grocery store, but at all times, if you can, stay at home, and if you want to go out and take your kids to the park, you can. You're not locked into your house, you're not barricading your home. You can take your kids to the park, you can enjoy the outdoors, just practice social distancing, use proper hygiene, wash your hands. What we're already asking the community to do is what was said last night.
So what does this change?
Well, I think it provides a statewide standard in terms of what all the counties are asking for in terms of allowing people to stay at home and calling for people to stay at home. But at the end of the day, in reality, what was said last night and what we're already doing are the same thing.
So how long could this last? That it was left open-ended.
Well, the goal right now is to bend the curve. What most people don't realize is that in the state of California, we have 74,000 beds in our hospitals. If you add the surge beds, we're probably at 95,000. So we have 95,000 total beds for the entire state. And we don't want our hospital system and our medical system overwhelmed with individuals going to the hospital, whether they're being tested or not, or if they've got any concerns. And so the goal is to try to bend the curve, ensure that people get tested, people get services, but that we're not overwhelming the system with individuals who are sick. So
we don't know how long this could last? Could it be weeks? Could it be months?
Well, the governor's statement last night was it's unclear. But right now we're trying to bend the curve. If you look at other countries, which is our best bet in terms of what they're experiencing, like South Korea, for example, is encouraging people to go back to work, to go back to normal. And so from in the short term, what we're doing is everyone exercise common sense, stay at home as much as possible, use proper hygiene, wash your hands. You can go out and enjoy the outdoors, but only go out for essential functions.
Okay, so I've gotten a lot of questions about what's allowed, what's not. So let's run down a few more of these. Someone actually asked me, is it okay to still pick up my kids for regularly scheduled visitation with them if perhaps I have shared custody with an ex-spouse?
Absolutely. If you are a caregiver and you need to take care of your children, and you have an arrangement with an ex or with your husband or wife, please continue to do that. What is being told of individuals that stay at home is to stay at home with your family. So if you need to go take care of your children, bring them home with you and take care of them.
And what about restaurants? We've heard curbside and delivery are still okay. What about drive-thrus?
Drive-thrus are okay. Restaurants are essential function but it's only drive-through, takeout, but no dine-in.
And let's talk a little bit more about the child care portion when we were talking about taking care of kids. That's a big issue right now, and you said you've actually been working to get local child care centers, at least some of them, to reopen.
So childcare is extremely important, something that as we go through this whole process and through this pandemic crisis, we are reevaluating a lot of the services that we need as a society. And I think when the schools closed, people realized that a number of services were provided by our schools, not only medication and education, but food as well. So we are encouraging child care centers to remain open. We're working through that, through the cleaning process, what was required of the state. But yes, we need, if first responders and nurses and doctors, if they have children, we want them to get their children into child care so that they can go to work and provide the essential services that we need.
All right.